Good afternoon. I'm Alan Spear. I'm a practicing cardiac surgeon in Fairfax, Virginia, and I'm the incoming chair of the Workforce on Government Relations. And we're here today with Drs. Blair Marshall and Dr. Jess Thompson to talk about what we can do, what you can do to contribute and participate in the governmental advocacy. As we know, given all the changes in the Washington area and in our specialty, we're in dire need of help in this regard and want to just present to you some options. Blair, would you like to introduce yourself further and then tell us a little bit about where you're practicing, and then Jess, same?
Sure. I'm Blair Marshall. I'm the current Chief of Thoracic Surgery at MedStar Georgetown University Hospital in Washington, D.C., clearly at Georgetown.
My name is Jess Thompson, and I'm a practicing congenital surgeon in Tucson, Arizona at the University of Arizona.
Jess and Blair are on the workforce, and perhaps we could start the discussion about the PAC that's available and the contributions.
That's great. Yeah. I contribute annually to the PAC. It's a very important contribution. This is the PAC, the money that supports our group in Washington to help make our efforts and our initiatives heard by our members of Congress.
I think that our PAC has been very successful in actively lobbying for the interests and the needs of our members. In fact, this past year we had very successful lobbying efforts to help with the sustainable growth factor and with getting us access to the federal data that we need in order to further our research efforts. And that's all because of the PAC and the contributions that were made to the PAC by our members.
I know, Jess, you've been involved with the what we term the fly-in, or contributing and participating in Washington. I wonder if you could discuss that a bit.
I appreciate that, Alan. You know, for the last 2 or 3 years, I've had the opportunity to go at least once a year, even sometimes twice a year, to Washington, D.C., and I'm able to meet with representatives from my home state, that is the state of Arizona. And I'll meet with the congressmen and women and their staffers and be able to discuss directly with my congressmen what issues are facing me as a practicing cardiothoracic surgeon. And we've been able to actually advocate for many of the things that directly affect our members, such as reimbursement, such as access to data, things that are going to help our patients directly. And more times than not, I find that our congresspeople do want to know what our needs are, and they're very willing to help us.
There's also been not only participation by the surgeons in Washington, but also the surgeons in their different locales setting up individual visits by their representatives in their home locale, with site visits in the hospitals, sharing with our governmental leaders and their staff what are the problems that are confronting us during this time, not only reimbursement, but safety and access. But Blair, you've also been very active on the workforce. I wonder if you could tell us a little bit about that initiative, the calls, and some of the documentation that we're contributing to.
I think, you know, when I first finished training and went into practice, I had actually no idea of how to participate in advocacy. And the STS has several opportunities to not only help you participate, but really to give you the information and access to ideas and support. You know, you mentioned the PAC, but actually our PAC has done great things, but we're really under represented in that I think contributions to the PAC are not what they should be given its impact and where we could go with it. If you look at our society compared to other societies like the malpractice lawyers or the hospital associations, the amount of money in our PAC is a fraction, just a drop in the bucket compared to what other societies have to spend. That's one area where someone can make an impact. For us, you know, you mentioned the SGR. The STS is very helpful in giving you the information if you want to write to your Congress members, identifying who your Congress members are, and giving you the literature so that you can sound like you're an expert on the topic. And these are all topics that really affect us on our day-to-day practice.
I know you mentioned individuals, the surgeons coming out of practice or coming out of training. I wonder if you could also mention the course, the leadership course at Brandeis.
Yeah. You know, the leadership course at Brandeis, I participated in several years ago now, and it really gives you a spectrum of where we are in the world in relation to how our healthcare system works, how government interacts with that, and where we're going in the future. And really now is a critical time. I just heard Fred Grover say this morning, the Affordable Care Act, it's not defined how this is going to be achieved. And here's an opportunity for STS members to really play a key role in how this plays out, because we are the ultimate advocates for our patients, and we know what good care is. And so interacting with members of Congress and giving them the tools to complete the Affordable Care Act, reduce costs, while maintaining quality and access for our patients.
Jess, have you been able to do anything on a local level with either the governmental leadership or their staff?
Yes, we've been able to do that. In fact, on several occasions, we've actually invited members of Congress, both from the Senate side and from the House side, to come to our facility and to tour our facility. And so both the congressmen and their staffers can see exactly how we're implementing the projects that we're coming and asking them for. For example, the Society of Thoracic Surgeons was very much an advocate for the TAVR programs and the TAVR registry with the National Coverage Determination. So then after that was implemented by Congress, then we actually brought our congressmen to our university to actually watch a TAVR so that they could understand better what that program truly entails. And we've also been able to, at a local level, so not just going to Washington, but I've been able to go to their home field office and meet with either the congressmen there or just their staffers and explain to them things like what do we face on a daily basis, and how can the federal government help us to accomplish exactly as Blair was saying, how we can better advocate for our patients, and how we can use the power of the government to leverage not only the finances but the resources available so that we can make sure that, for example, underserved populations have the same access to quality cardiothoracic specialties that our patients that have means have. And I found them to always be very excited to come and talk with us at the local level, because we are their constituents. We're the ones that elect them into office. And they really want to know how they can improve their constituency. And so they always want to listen. And I found that if we can go to them with a very clear and concise plan of what we need, that they're always able to help us out.
I was just going to add on that, in that certainly in Washington, part of the patient population that I see might be lawyers and people who are very well versed in healthcare. And I frequently talk to some of my patients about the issues that we're facing and how I think it's going to impact the future generation of patients. For example, I just saw a patient last week who I operated on a year ago, and he had a minimally invasive procedure done as an outpatient, and he's 82, still practicing lawyer, clearly well selected, but he said, Dr. Marshall, why isn't everybody doing this? And I said, you wouldn't imagine, but sometimes the incentives are misplaced, and actually thoracic surgeons get paid less to do it minimally invasively, even though it's harder and it takes longer, than they do open. And so there's really, for many surgeons, no incentive to go learn a new type of procedure, try to do it less invasively when it's harder for them, and in the long run, what benefit is it going to get them? But it's important to continue to advocate for our patients and let our patients be aware of the issues that might be impacting their care.
I'd like to thank you both, Blair and Jess, for your time this afternoon. Obviously, given the constraints of time, each of these subjects could be the format for a long discussion, but this problem is not just those on the workforce, but is really for all of us. And I'd like to urge each of you to be involved at your local level, not only with calls, but reaching out to your congressman, making these issues known and your support known. It's only one phone call, but particularly being involved with the PAC to allow those of us that are coming in and are seeking to be supportive of this in the Washington level to reach out in a more fundamental and important way. But again, thank you both for your time, and thank you for your attention.